Monteiro will be talking to us, and the subject of his talk will be Brazil Dietary Guidelines, a model for the region.
Thank you very much. So essentially what I intend to do first is to explain why many people believe dietary guidelines are useless. Then I'll present to you the new Brazilian dietary guidelines, and of course we intend that they are useful. And if we have time, I'll tell you about some preliminary evaluation we did in Brazil of these guidelines and the applicability to other Latin American countries. So conventional dietary guidelines have a lot of problems, and we try to avoid these problems. What are these problems? The first one is that these conventional guidelines, they make recommendation on a number of servings of different food groups to fulfill nutrient requirements, okay? So grams of protein, milligrams of iron, vitamins, etc. So what's wrong with this? First, diet is much more than nutrients. So diet has other attributes that are equally important to define health. And so we could say that this is a limited vision of recommendations. But even in the field of nutrients, there's another problem because they don't distinguish foods from food products. So for instance, at the basis of the foods that should be eaten in more quantity, we have cereal and cereal products because they provide carbohydrates. So this recommendation assumes that the carbohydrate in a grain, in corn or wheat, or in bread, or in cereal breakfast, or even muffins, they have the same impact on our biology. And we know today that this is not true. This happens also with the other groups. And at the top of the pyramid, on the foods that should be consumed sparingly, there's another big mistake, because the recommendation put together culinary ingredients like oils, salt, and sugar, together with fat, salty, and sugar snacks. They are used by people in a different way. You need, for example, vegetable oils. You cannot cook if you don't use them. So you cannot use them sparingly. You need to use them daily if you cook. And this brings another problem with these guidelines, which is the fact that they ignore or overlook dishes and meals. They treat foods as static, as isolated things. And people, in the most food cultures, the foods are eaten together in combinations, in dishes and meals. And finally, these guidelines usually totally ignore the origin of the food system which is underlying the foods that are recommended. And as you will see, the food system, the way it's organized, affects our health in a very important way. So then we try to depart from these limitations, let's say, with the new Brazilian dietary guidelines. Before starting to summarize the guidelines, I have to say that the reception in Brazil of these guidelines was very, very good in different audiences, from family farmers to chefs. And also outside of Brazil, the original aspects of the guidelines were very much appreciated. So the guide is 152 pages, fully illustrated, with 5 chapters, starting with principles. And this is one of the original things of the guidelines, because usually guidelines don't present the principles, although they have principles, but we decide to make our principles explicit. So the first principle says that diet is more than the intake of nutrients. So what we consider in our recommendation are 3 aspects of diets. First of all, not nutrients, but foods, because nutrients in foods are more than nutrients. And then also we consider the combination of foods into dishes and meals, and also eating patterns. In foods, meals, and eating patterns, each of these aspects of diet is important for defining the effects on health. And of course, we distinguish real foods from food products or fake foods, we could say, true meals from fake meals, and these two types of eating patterns, let's say the traditional eating patterns, the modern eating patterns. So the second principle states that healthy diets derive from socially, environmentally sustainable food systems. And then we explain to the reader what is the mechanism that link diet to the food system and the food system with our health. So what elements we need to consider in the food that we are eating? Elements that define natural resources, biodiversity, and social justice. So for instance, what are the amount of water and of energy that's used in the production of the food? What techniques are used for soil conservation? What type of fertilizers we are using? Biological or chemical control of plagues, extensive or intensive breeding of animals, husbandry of forest, landscape, wildlife, intensity of the food processing, because this also affects the environment, size and use of farms, effect on local communities, income distribution, etc., etc. The other three remaining principles are also very important. The third one states that dietary recommendations need to be tuned to their times. In other ways, we need to follow or to respond to the scenario that Barry Popkin showed to us. We need to consider changes in the food system that we already discussed here in this meeting. The fourth principle states that we need evidence for the dietary guidelines, but not just evidence provided by randomized control trials. Because if we just restrict the evidence to randomized control trials, we'll come up with recommendation nutrients and to avoid specific diseases, and that was not our aim. And finally, dietary guidelines should broaden autonomy in food choices. So we anticipated the reader that we don't expect that he has to learn or how to count calories or to know what is a serving of a banana, if it's a full banana or it's half banana. So these type of things that you find in conventional dietary guidelines, they are not present in our guidelines because we don't want to prescribe diets for people. We want to increase the autonomy of people to make choices. So what are recommendations? We have 4 basic recommendations, and we have 4 basic food groups, 1 recommendation for each food group. And we don't define our food groups according to botanic species, for instance. We define the first group as the all natural or minimally processed foods. So grains, fruits, vegetables, roots, meat, milk, everything which is not added of any substance. Okay, they can be packaged, they can be refrigerated, fermented, but they cannot be added of any substance like salt or sugar. So what is the recommendation regarding this group? Make them the basis of your diet. But we present 3 qualifications which are very important. The first one, they must be in great variety. So we tell the reader, there's no superfoods. I mean, every food is okay, provided that you consume them with other foods, of other food groups. The second qualification, most should be of plant origin, and this is much more because of environmental concerns than for health concerns. And whenever possible, produced by agroecological family farmers. And what we say, whenever possible, because we admit that today is impossible to have every food from this system. But we discussed this in one final chapter when we discussed the obstacles, what we have to, the obstacles against these recommendations and how they can be overcome. The second recommendation is about processed culinary ingredients, essentially oils, salt, and sugar. Most conventional dietary guidelines, they suggest or recommend the sparing use of these culinary ingredients. And as I told you before, they are absolutely essential. So the message here is not frequency, it's not used once a week, but used in small amounts. And why? Because if they are used in big amounts, they will dilute the advantages of the first group. The third recommendation is about processed foods. And here we distinguish processed from ultra-processed foods. And this distinction is very, very important. Processed foods are essentially minimally processed foods that were added of salt or sugar or other substance of culinary use by the industry. So they are industrial products, but they are, let's say, simple products. And a very important characteristic of this group is that you can use them in a diet based on foods. So essentially, what we recommend is a diet made of these three food groups. Based on the first one, small amounts of the second one, and the third one. By using this, you can prepare a dish like this. When I said that reception was very good of the guidelines, there was a big exception. So part of the food industry didn't like the guidelines, and they said, oh, you are against food processing, and you see food processing as something that's not useful. On the contrary, you see that most of the ingredients of this dish are processed. So then it's a particular type of processed food that we recommend avoidance. It's ultra-processed products, okay? So, and why we say this? Why we don't say, most guidelines, they say soft drinks, okay, on Sundays. We don't say this, we say avoid. And why we say avoid? Because of the formulation of these products, because of their ingredients, they are nutritionally imbalanced. They are based on fats, unhealthy fats in general, sugar, salt. But it's more than that. They are formulated to replace real foods. So you don't get these foods if you don't take out the true foods. So then we cannot say use this sparingly. We need to say avoid. And more than that, they are formulated not only to replace real foods, but they are formulated to be consumed in excess, to become a habit, or even to make people addicted. So then, because of this formulation of these products are done like this way, so the recommendation should be avoid. And besides this, the production, distribution, marketing, and consumption of these products damage culture, social life, and the environment. And we explain to the reader how they do this. We define what is processed and ultra-processed in a formal way, but we also tell people that a very easy way to distinguish processed from ultra-processed foods is to read the list of ingredients. Of these packaged products, in most countries, they are obliged to have a list of ingredients. And the list of ingredients is the most important thing. I mean, the rest of the label is just advertisement of the product. So don't read it. You have to read the list of ingredients. And in the list of ingredients, I can distinguish processed from ultra-processed easily. In processed foods, you always have a food as a first component, the main ingredient, because they are obliged to list ingredients in order of importance. So then you have examples of processed food that are old foods that are part of our diet for many, many, many years. And then you have examples of ultra-processed foods, where you have 10, 15, 20, 30 ingredients. And most ingredients of these products are not salt or sugar or oil or other substance of culinary use. Most ingredients are additives, and are not the old additives used to preserve the foods. They are additives. We call them cosmetic additives, because they are used to give to these products great attractiveness. They are used to simulate flavor, color, texture of real foods and real culinary preparations, or to be more attractive, actually, than, and that's why they are consumed in excess. Additives are very important, and additives are not regulated. I mean, the regulation of our countries on additives is from the last century, and they were not revised. And today, the food industry can do anything, and anything that you consume in excess by nature. So another thing that we don't say to the reader, because this is an official guidelines from Brazilian government, but I'm telling you now that a way to separate process from ultra process is to see the brand. If you have one of these 10 brands, then it's very likely that you have an ultra processed product. At the same time, this is important to consider because these 10 companies, the sales, the daily sales of the products they do amounts to more than $1 billion a day. So considering that the 4 recommendations, then you say people will not consume foods or culinary ingredients separate. They consume into dishes and meals. So then what we did, we took in our last national dietary survey, we took real examples of people that were following our recommendations. And these represent about 20% of the Brazilian population that still have these traditional dietary patterns with a very small consumption of ultra-processed foods and dishes based on foods. And then we took pictures of breakfast, lunch, and dinners of real from different Brazilian regions. And then we tell to the reader, so these are just examples, right? So you don't need to copy exactly this, but you can multiply these examples by 100, by 1,000, just by changing 2 foods from the same group. So, for instance, we start with beans, because beans is very important in Brazilian diet. So we say there are different types of beans. They have protein, they have iron, they have fiber. That's why they are very good. But more than that, they can be prepared in different ways. We say this for beans, for true cereals, for roots that are considered low nutritious food. Because, I mean, if you just analyze cassava, for instance, by itself, you say, oh, this is unhealthy. But how you consume cassava? I mean, you have to consider the whole diet. Vegetables, the same. Fruits, nuts, milk, egg, fish, and meat. And then there's a specific recommendation on the need to reduce the consumption of meat, and then water. Then chapter 4, so chapter 2 about what foods, chapter 3 transforming foods into dishes, and chapter 4 is about how to eat. And modes of eating, which is normally absent from dietary guidelines, is one of the most important aspects of the diet that influence the capacity, our capacity of regulate our energy balance. So unhealthy eating patterns are underlying obesity, underlying weight gain. So we need to talk about them. And also, 3 recommendations on eating modes. Eat regularly and mindfully, eat in pleasant surroundings, eat in company. And to justify how these can help you to regulate your energy balance and prevent excessive weight gain, and how this can be your moments of eating much more interesting, much more pleasurable. Because eating includes, of course, pleasure. This is part of what eating is. Then we have a chapter on obstacles. That's very important because at this point we have a very open discussion with the reader, saying, well, maybe the environment where you live is not 100% okay to practice these recommendations. But then we address people as individuals and as citizens that are able to act politically to change the environment through regulations, through pressure, etc. So these are the main obstacles. Supplying cost of minimally processed foods. So here we talk about organic, about agroecology. We say to people, okay, buy as much as possible you can from this system, and then this system will get improved in the future, and then you have more supply of these foods in the future. So people can really change the environment with their practice. Lack of culinary skills, so there's a lot of this aspect in the recommendation, lack of time, and aggressive marketing of ultra-processed products. There's a final session on we avoid any technical term and any technical consideration reference, but we have a chapter where for each chapter, we provide references for people that want to know more about the guidelines. So very, very quickly, we did evaluation in Brazil of these guidelines, and then we compare people that were practicing the guidelines against those that are very apart from the recommendation. So the very high adherence is people that had almost zero consumption of ultra-processed food, 3-4% of calories. And very low, we have 50% of calories coming from ultra-processed foods. So you can see that every nutrient we don't want to increase in the diet, they increase where people depart from the recommendation of the guidelines. And this is very important because some people think, oh, this is a guide just for chronic disease and obesity. No. If you see protein, zinc, iron, all of these are in higher concentration for people that already are following the recommendation. And also, we demonstrate that the risk of obesity is higher for people that are more apart from the recommendations. So applicability to Latin American countries. Paulo just published this book on the presence and the sales of ultra-processed products in several Latin American countries, 19 Latin American countries, including Colombia, of course, and Brazil. And then from this publication, you can see the level of consumption of ultra-processed products in different countries. You see, in the United States, they consume 300 kilos per person of not all ultra-processed products, the most important. And then you can see Colombia is 90, but Mexico is 214. So you can see that the room for increase that you have, these are trends for 10 years. Look how the sales of these products, how they evolve in just 10 years. In some countries, they double the sales. So that's the reality we are living. And here's what's very interesting, is the value of annual sales of carbonated soft drinks in North and Latin America. And you can see that now these companies, they sell more soft drinks in Latin America than in North America. And this is, I think, is the final slide. It's an interesting analysis relating animal changes in these ultra-processed products and animal changes in the population BMI of the population. And you can see there's a very high correlation. So when the increasing sales is higher the increasing BMI. So this is just to tell you that it's a collective work. So this is a picture of one of these workshops, so people from Ministry of Health, people from my university, and people from several universities that participate in the development of the guidelines.